Repealing Obamacare by Takia Jackson. Being a social services benefits worker, I felt particularly strong about this topic because it could affect my job at social services and millions of people would be without health insurance. Obamacare was a law that was passed back in 2010 to provide affordable health insurance for everyone, to expand Medicaid and to expand Medicare. While it helped millions of Americans with pre-existing conditions, it also became a hindrance for other Americans. As you can see in this slide, the timeline from when it first started in 2010 all the way to 2015, how it impacted so many American lives. Towards the end of this timeline, it looks like an estimated 16 million who previously lacked health insurance now were able to afford health insurance. And then 7.7 million received subsidies through federal exchanges. Some of the pros to having Obamacare: many people received affordable health insurance with pre-existing conditions. I know on a couple of interviews I had seen where previous cancer patients, which involves a lot of health care and it can get really expensive without them having insurance, they were able to start receiving treatment from this Obamacare insurance. And it subsidized health insurance, and it also allowed kids under 26 to be able to stay on their parents' insurance. And it also required larger businesses to be able to extend the insurance to their employees. And the pros, there were definitely some cons regarding Obamacare. It caused tax returns to decrease, I believe, because maybe more money was going into the health insurance and they cut back on the tax returns. And some people still argued that it wasn't affordable. Small businesses with less revenue could not afford to pay their employees and provide insurance. And another downside was that you did have to pay a penalty if you did not have the insurance. How this all ties into sociology, I believe that health is a really important thing for somebody's well-being, and it ties into sociology as stated in Sociology Matters on page 280. For example, poor and rural areas tend to be underserved because medical services concentrate where people are wealthy, and healthcare prevents social epidemiology, and people deserve to have health care to prevent this from happening. Sociology matters because it considers the perspectives of all classes and try to implement worldwide changes based on statistics. It is a right and not a privilege to have health care.